you this dude here. Away a little bit. So again, here is our main dude, and I'm going to go to preset number 1 to start with. And this shows some of the upper chest muscles, and I have colored them and taken pictures of these, and these are the ones that are available for you guys online. All right, so the white is the pectoralis major muscles, and one of the things you should know for these muscles is not only the names of them, but kind of what they do. And you can imagine what the pectoralis major muscles do. I mean, you know, flex your, move your arms, swim. The butterfly stroke or the breaststroke is something that you would use your pec muscles. They also are a little bit involved in breathing. Most of the chest muscles and abdominal muscles will help with the breathing as well. You can see them better in men because in women, pretty much our boobs cover them up, which no big surprise there. In fact, I had a double mastectomy after having breast cancer, and one of the ways that they do reconstructive surgery is put air balloons kind of behind your pecs and slowly pump them up and allow the pec muscles to grow and stretch over those little balloons. And so you end up with boobs made out of muscle, which it's just one of the options that they can do, which is kind of weird.
I didn't know that they did that. It's
I did not.
Cool thing they do.
Yeah, I did not know that either. I mean, you can get the silicone implants, which a lot of women do. But one of the advantages apparently is silicone only lasts like 20 years. And if you're young, like I was when I got breast cancer, I would have to have them replaced eventually. And this one, you don't. But it can take a long time because it takes a while for your to adjust and grow for that. So you're going to have small boobs to start with, you know.
Just like teenagehood all over.
That's right. That's right. You get to start all over. All right, the blue muscles over the shoulder, of course, are your deltoids. And your deltoids are going to be involved in moving your arms up, which you guys know, of course, is abduction. X to bring your arms back down. Adduction. The pale yellow muscle
biceps
here.
brachii muscle.
In front of the arms, or in the medial side, are the biceps brachii, and the red ones are the triceps brachii. They are antagonistic muscles, which means they do the opposite action. Biceps flex your arm, so bend your elbow, and triceps extend it. Okay, so antagonistic muscles do the opposite things. The green muscle that looks like it kind of comes to a V, that is the sternocleidomastoid muscle. And it's named for the 3 bones it's attached to. The sternum, cleido is clavicle, and mastoid is the mastoid process of the temporal bone, involved in moving your neck. Around the lips are the orbicularis oris, and the blue muscle in this one, or the kind of the baby muscle. Blue, the teal, is the masseter, the main one involved in chewing. Mastication is the fancy word for chewing. Okay, so there's some of the muscles colored. Now, obviously, there's lots of muscles in this picture that are not colored that you could name, that you're supposed to know. This little muscle kind of between the triceps and biceps is the brachialis muscle. The brachialis muscle pretty much does what the biceps brachii does, so it's called synergistic. Synergistic muscles help the prime mover. The prime mover in flexing your arm is the biceps brachii. That's the big one, the main one, does most of the work. A synergistic muscle, like the brachialis, just helps that. Another muscle that people tend to confuse with brachialis is brachioradialis muscle. Okay, and I'll color that one so you guys can see it. I'll color it white there. The brachioradialis goes down further. It goes down to the forearm, not something the brachialis does or that you can see. Brachioradialis is going to be involved in some of the lower arm movements and twisting and that type of thing. Another one that you have to know on the lower arm and I'll show you that on another picture, but you can see it
Extensor
here,
digitorum muscle.
is the extensor digitorum muscle. Extensor digitorum extends your digits. Okay, and you can see the tendons going up to the bone from that muscle. If I turn him over a little, you can see the sternocleidomastoid back up there to the mastoid process. You can see that pretty well. Okay, and you can see that over the shoulder
Trapezius
muscle
muscle.
right there, the trapezius, which always feels good when somebody massages it. All right, so let's go to preset number 2 here.
Adductor magnus muscle.
Preset number 2 is essentially the same picture with the labels on it. So there's another option. I put them in the PowerPoint. I named them by color so that you could click through and try to name them before you saw them, and then you could click the button and the names would slowly appear. All right, how about number 3? Number 3, I try to show some of the deeper muscles. On the left side of this dude is the pectoralis major in white. We saw that before. If you take that off, you can see the pectoralis minor, which is this green one on the right side. Okay, so pectoralis minor is just smaller and deeper. Another muscle under there is this one that looks like a jagged knife edge. That's the serratus anterior. That one also is attached to your ribs and helps you breathe. Sometimes when you have a really bad cough, you can cough so hard you can pull that muscle. That's why your sides hurt sometimes. Okay, so those are a couple of muscles that are underneath the pectoralis major. Up on top, the white muscles over his eyes are the orbicularis oculi, involved in moving your eyes all different directions. The red is the
Occipital frontalis muscle.
The occipital frontalis, sometimes it's called the epicranius muscle. It actually is a little bit of muscle tissue like above your eyebrows called the frontalis muscle, a little bit of tissue in the back of your head attached to the occipital lobe. Okay, and if we click off of that, it'll show it in
Trapezius
red
muscle.
back here. And then there's kind of a tendon over top of your skull. So together, it's called the occipital frontalis or epicranius muscle. Seriously, all it does is raise your eyebrows. No, there's a lot of names and a lot of parts to it, and really all it does is raise your eyebrows. All right, so if we turn him back over, one other muscle you can see that is on your list is the yellow one. Underneath the masseter a little bit, behind the orbicularis oris, the run around his lips, that is the buccinator. Buccinator helps blow up a balloon or that type of thing. Also involved in chewing, of course, but one of the main things it does is help you blow. All right, the abdominal muscles, which I don't think are great with this virtual cadaver. The one on the left side of this
External
guy, I do
oblique
not
muscle.
have colored. That, if you look real close, I don't know, Alicia, if you can see it at home, but the fibers run kind of at an oblique angle from the top towards the bottom. If I do an arrow here, it's running this direction, the fibers are, from the external oblique.
Yeah, you can kind of see it.
You can kind of see the fibers. If I color it, you can't see the fibers.
Yeah.
So that's the disadvantage of coloring them. The external oblique is the most superficial one. You take off the external oblique, you get the internal oblique. Oh, I gotta clear my labels.
Internal oblique muscle.
Okay, this is the internal oblique, and if I uncolor that, I uncolor it. And I just tapped it. There. The fibers on the internal oblique actually run the opposite direction. Okay, those run like this. The internal oblique run the other way. And then if you take out the internal oblique, you get this one out
Transverse
here, which
abdominal
runs
muscle.
horizontal. That's the transverse abdominis. So it goes external, internal, transverse. And then in the middle is the six, the
Rectus
six pack
abdominal
of
muscle.
abs. And I'll say this because there's only women here. Guys that have really don't have any body fat, you can see these little
Rectus abdominal
areas
muscle.
where there's
Rectus abdominal.
white,
Rectus
where those
abdominal
tendons.
muscle.
You can't see that on me anymore. I'm too fat. I would love to have, ripped abs, but when you can see that in a very muscle toned person, and usually men, because not that women don't have this muscle, but ours is not usually as quite as developed. Anyway, that is the rectus abdominis. All four of those abdominal muscles are involved in breathing and in defecating, but also things like doing the twist or doing the limbo or bending up and down. You need all kinds of them. And of course, when you have abdominal surgery, they got to cut through these. I had my appendix out at one point, and they thought they could do it laparoscopically, but apparently my appendix was too big, and they had to make a couple of incisions to get it out of me. Oh my God, every time I sneezed or coughed or laughed for 2 months after that surgery, I could feel that twinge because those muscles had been cut through. And that's another reason women who've had C-sections, they're going to cut through those muscles, and it takes a little while to heal. Yeah, you can get up and move around, but oh my God, don't pee or laugh or get constipated. And of course, that's very common after surgery because pain medications tend to do that to you. Well, it hurts to push. So it can be pretty sore because cutting through a muscle can be painful. All right, so let's go back to his normal, what was I on, number 3, right?
Yes.
Let's go back to his normal thing so we can see this here. Those are the abdominal muscles. The purple one here in his lower arm, again, extensor digitorum longus. The teal green one in the forearm. You guys remember what that one is? We just did it. Starts with a B.
The brachialis.
Brachioradialis, and the blue one is brachialis.
Darn it.
Brachialis and brachioradialis are serious. The two that students get switched around. And you can see why. The names are practically the same, and they're practically in the same spot. Okay, so let's go to number 4. Number 4, again, some more of the abdominal ones. This green one is going to be rectus abdominis, and the blue or the red one is going to be transverse abdominis. The yellow one there is the trapezius. So if we turn him over, look how big the trapezius muscle is. It is huge. Okay, there's a right and a left. And when I first started teaching A&P, they taught it as 3 different muscles. And now I've seen some reference to like medial, lateral, and vertebral, or whatever. They grouped them into different groupings. You guys just have to know this as trapezius. And of course, what are you going to use the trapezius for? Lots of different things. Hold up your head, for one. Also, some of the shoulder movements and back, if you want to do this kind of thing, squeeze your scapulas together. The trapezius muscle is involved in a lot because it's pretty good size. Okay, and the next one, we're going to take that trapezius off, okay, because in order to see some of the muscles underneath it, you need to take it away. But leaving it on for a second here, some of the other ones are colored, so we'll start at the yellow one is the trapezius. This big blue one is your latissimus dorsi. Hopefully dorsal, remember back, it is the largest muscle space-wise. And it does all kinds of things. It attaches up underneath your arm, like in the front. You can kind of see how it's going up underneath those green muscles there. So it's involved in some of your arm movements. But if you were rowing or swimming or twisting, you would use this muscle. The red ones are the deltoids, which we did before, different colors. So I'm going to take those away. I'm going to take away
muscle.
the trapezius muscle.
Trapezius muscle.
Okay. I'm going to take away the deltoid muscles.
Muscle.
And you're going to see
Deltoid muscle.
3 muscles there, white, purple, and green. Those are 3 of the 4 rotator cuff muscles. And if you have shoulder injuries or shoulder issues like Ariel here, 1 or more of those, you might have pulled a tendon or torn or something, because shoulder injuries are very common. Anyway, the white one
Infraspinatus
is
muscle.
the infraspinatus muscle. Notice the spine of the scapula there, the space underneath it, because you just got done with bones, so of course you remember that was the infraspinous fossa.
Yeah.
And located in that is the infraspinatus muscle. Right above it, which is not
Supraspinatus
colored,
muscle.
so let's color that one yellow. That's the supraspinatus, because it's above, superior to the spine. So there it is on the right
Supraspinatus
side of this
muscle.
dude. Make that yellow too. The green
Teres major muscle.
is the teres major, and the purple
Teres
is the
minor
teres
muscle.
minor. The teres minor, infraspinatus, supraspinatus, and subscapularis are the rotator cuff. Teres major is not, which I don't understand, because it's involved in rotating and moving the arm just as much as the other 3, but somebody along the way decided that, and nobody consulted me. Silly. This muscle
Rhomboid
right
major
here, and I think I have it colored on another slide, but if I make this one kind of a baby blue, that is the
Rhomboid major
rhomboidus muscle. Rhomboid, there's a minor and a major, and that's the major. Again, helps you move your arms, squeeze your scapula, and then stretch it, okay, back and forth. I know Alicia can't see what I'm doing, but what's this movement? When you move your arms in front of you, and then if your elbows are bent, you put them in front of you, and then put them as far back as you point your elbows as far back as you can, like you're sticking your boobs out. Okay, and you would do that kind of thing probably to expand your pecs and also to exercise your trapezius and your rhomboidus muscles. Now the latissimus dorsi is in blue, and there are muscles underneath that.
Latissimus
But
dorsi
you don't have to
muscle.
know any of those. This muscle right there,
Longissimus thoracic muscle.
longissimus thoracic and the psoas major, I
Iliacus
think.
lumborum muscle.
Those are your tenderloins. If you ever had
Longissimus
to eat a
thoracic
person, that's the
muscle.
one you'd want to chew on. Okay, the purple muscle here is the gluteus maximus, your butt muscles. This is what you're sitting on. The gluteus maximus, not only do you sit on them, but they're used for extending and flexing your hip joint, your legs. So kicking with your whole leg, not bending your knees. The gluteus maximus does not bend your knees. It moves the whole leg up and down. And there's a
Gluteus
smaller
maximus
one underneath it called the gluteus medius. So if you take off the gluteus maximus,
Gluteus
you can
medius
see
muscle.
the gluteus. You can actually see the top of it. Make it that color. You can see the
Gluteus
top of it
medius muscle.
underneath the gluteus maximus. So far, so good? All right, the red, white, and blue muscles on the back of this guy's legs are his hamstrings. And the hamstrings, again, involved in walking, kicking. When your quads are on your front, your hamstrings are on your back. Think of a ham on a pig. You're looking at its butt. So you're looking at a person's butt. You're looking at their hamstrings, and they're from their butt down to their knee. The hamstring muscles and the quad muscles are antagonistic, right? When your quads contract, it causes your knee to come up or your knee to bend. When your hamstrings contract, it extends that. So now you're kicking a ball just with your knee. Okay? And they do other stuff too, but that's one of the main ones. Obviously, you need to do that when you walk. You bend your knees to walk, and then extend and bend, extend and bend, extend and flex. Okay, so when you're looking at the 3 hamstrings, the one that's on the most lateral, which is the
Biceps
red,
femoris muscle.
is the biceps femoris. The one in the middle
Semitendinosus muscle.
is the semitendinosus, and you can see when it's the white muscle, and the blue muscle is kind of underneath it. It's on both sides of it. That's the semimembranosus. Membranosus I remember because it's most medial. Tendinosus is in the middle, and biceps femoris is the most on the outside.
Iliotibial band.
Those are your hamstrings. The big yellow one is your
Gastrocnemius muscle.
gastrocnemius. It's got a funny C in there. It's kind of spelled a little bit. That's your large calf muscle. And you can see the tendon goes all the way down and attaches to the calcaneus. Okay, it attaches to the calcaneus bone, and then the tendon, of course, attaches to the muscle. Tendons attach bones to muscles. And that is sometimes referred to as your Achilles tendon. If you cut that, you're not going to be able to bend your foot because contraction of this pulls your foot up. Again, use it in walking because we bend our feet, right? If you think about taking a step, which is why, you can feel that calf muscle contract and relax when you walk. There's another smaller muscle underneath
Soleus muscle.
called the soleus muscle. If I color that one purple, you can see that there. There's the soleus muscle. Another calf muscle runs right behind your tibia there. It's not as big as the gastrocnemius, but it does similar stuff. Okay, if I flip this guy over, I don't know if I have the quads. I don't have the quads on this one, so it must be on number 6. Let's see what number 6 is. Oh, 6 shows rotator cuff muscles. How about number 7? Okay, the number 7,
Subscapularis muscle.
that is the subscapularis muscle. The subscapularis, think about a submarine is under the water. Subscapularis is under the scapula. In this picture, the scapula is actually missing. Okay, I had to remove the bone because the only other way to see this muscle is to flip him over and take everything out behind, like all his lungs and stuff, and look underneath the scapula. Think about where that would be.
That seems like a lot of work.
It does. It's hell on a real cadaver to actually dissect to get to this one. And so I took off the scapula here so you could see that blue muscle is the subscapularis. All right. I think 9 is back to normal. We got to go find the quads. Maybe that was number 1. Did we have the quads lit up for number 1?
You try 8?
Did I try 8? The yellow in number 8 is the diaphragm, okay, used for breathing, and the white is the platysma muscle, which almost always is removed when you remove the skin because it is extremely superficial, but it plays a huge role in our facial expressions when you pull your mouth down and smiling and that type of thing. All right. I'm going to have to just find my quads. All right, I'm just going to color the quads then. The first muscle that I'm going to point out is called the sartorius muscle. The sartorius muscle is this
Great
one.
saphenous vein.
Well, no,
Sartorius
it's
muscle.
this one. The sartorius kind of starts from the outside of the hip, the lateral side, and it goes across, down, and attaches to the medial side of the tibia. So it is going to be involved in abduction and adduction of the leg. And then there's this muscle right here. That is the tensor fascia latae, which sounds like coffee to me. That muscle is actually pretty short, but it actually has a tendon or a piece of fascia that it goes all the way down and attaches down. It looks pretty short because that's the only muscle part, but it does have a fascia attachment all the way down. All right, so if we take away the tensor fascia latae muscle, let's remove it on this side and remove it on that side. I'm going to color it over here so you guys can
tensor fasciae latae muscle.
Remember where they are. Okay, but on this side they're gone. Okay, so this big muscle right here is the rectus femoris. That's one of your quads. We're going to make these red, white, and blue too. So we'll make this one red. Okay. Red. There we go. And on either side of the quad is a vastus muscle.
Lateralis
vastus lateralis on the lateral side. Okay. And vastus medialis on the medial side. Okay? Vastus intermedialis is underneath the rectus femoris. That's the four muscles that make up the quads. You guys got to be able to identify the blue one as vastus lateralis, the red one is rectus femoris, femoris right over the femur. Remember this one up here, the green one here is rectus abdominis. And then vastus medialis on the middle side. Okay, so
Rectus
that one
femoris muscle.
is going to be rectus femoris on the left, vastus
Vastus
lateralis
lateralis muscle.
on the left leg, and the
Vastus
left
medialis
vastus
muscle.
medialis. Those are your quads. So far, so good?
Yep.
All right, the last muscles that we haven't done yet are some of these in here.
Adductor
On the
longate muscle.
inside of your legs, these are the adductor muscles. Guess what they do? Adduct, right? So they're going to bring your legs back. If you did the splits or jumping jacks, okay, they would bring your legs back. There's adductor longus and adductor magnus
Pectineus muscle. Gracilis
and
muscle.
gracilis. There's gracilis.
Adductor longate muscle.
Adductor longus. I don't know if I can, maybe magnus isn't going to show without taking some of these off, but I think that's
Iliacus
adductor
muscle.
magnus, is it? No, that's iliacus, which is not on your list. Sometimes they're hard to see because that's a
Gray saphenous vein.
Hey, okay. Keep clicking on the veins. Get rid of them.
Gracilis muscle.
That's gracilis. Let's make it a different color since I already used that one. How about that one? There's adductor
Adductor longate muscle.
longus. Let's make that one pale green. And there's
Adductor
adductor
magnus
magnus.
muscle.
Pale purple. Okay, so the pale green, pale purple, and pale blue there are your adductors, or the ones that help you move your legs sideways rather than walking. Does that help, Alicia?
This is from AMP1, right?
Yeah. Oh, yeah. You're an AP too.
Yeah, I am. I'm just.
Oh, yeah. I should have known that.
That's okay. This is a good review for me though because I didn't remember all of these and I didn't go to the cadaver sessions then. So this is it's a really cool program.
Yeah, it really is. I have pictures in AMP1 for you guys on PowerPoints, and I use these colored pictures. I took pictures of the cadaver, but I wanted to do that for you guys in AMP2 for the blood vessels, but they're so tiny. When I took the pictures, they didn't blow up enough. And the cadaver pictures that I have in there, they're not great. I don't, but they're way better than these guys. The ones that I robbed from another cadaver program years and years ago. I'm probably legally not supposed to use them because it was from the McGraw-Hill textbook, and I haven't used McGraw-Hill textbook in God knows how many years. I think
Oh, sorry.
yeah, did you use...
I was going to say the ones from the digestive system were really nice. Are those the ones that you're talking
Yeah.
about? Because it was a different...
I did use these cadavers for the digestive system
Okay.
picture. Didn't I?
I
Maybe
don't
they're
think
still
so.
the old ones.
It looked more
Right.
like preserved. Like it was definitely...
Yeah. It was definitely individualized pictures.
Yeah.
Each one highlighted. Yeah. So I haven't got them all adapted to use this virtual cadaver. And I think if you were in class, coming here and using this to look at blood vessels would be cool because you can watch blood circulate through them.
Wow,
But
yeah, that would be really
as
cool.
still pictures, I think the diagrams in the textbooks are actually better, more clear for students to learn them anyway. Okie dokie. I'm going to stop the recording.